Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center, the Four Leaf Lifestyle Medical Group Corporation, the Plated Prescriptions, and the Culinary MD. This event is also made possible through the help of our sponsors, the Pascual Pharma Corporation, the Omron, Simply Nature, and the Foligo.
Our gut is home to trillions of living microorganisms. In order to live, multiply, and perform their functions, they need to be fed sufficiently. Or else, they'll look for other sources of food within our body, which will eventually make us sick. Fruits and vegetables contain prebiotics, such as fructooligosaccharides, the right food for our gut bacteria. However, proper amount may not be acquired through natural food only. Hence, supplementation is needed too. Foligo is an all-purpose prebiotic powder that can be added to commonly consumed food and drinks, hot or cold. Each sachet contains significant amount of pure and highly concentrated fructooligosaccharides for prebiotic supplementation. Fructooligosaccharides are generally recognized as safe and has been proven to promote growth of beneficial microbes in our gut, resulting to healthy digestion, absorption, and elimination of food. Additionally, it enhances production of metabolites that are beneficial not only to the gastrointestinal tract, but also to distant organs and body systems. A well-fed gut will also improve immunity and decrease the risk of allergy, reducing the overall risk for a wide array of chronic diseases. Feed your gut with Foligo.
Dr. Julius Cabison is a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine. He is also a diplomate of the Philippine College of Occupational Medicine and Family Medicine. He is affiliated with MaxiCare Primary Care Center Davao, Southern Philippines Medical Center as a consultant. He earned his degree in medicine at the West Visayas State University and completed his residency training in family and community medicine at Davao Regional Hospital. Dr. Julius Cabison will talk about plant-based nutrition for chronic kidney disease.
Good afternoon, everyone. My topic for today is plant-based nutrition for chronic kidney disease. My objectives are the following. Chronic kidney disease or CKD is defined as abnormalities of kidney structure or function. It must be present for more than 3 months and with implications for health. CKD is classified based on cause, GFR category, and albuminuria. This shows the prognosis of CKD by GFR and albuminuria categories. The lower the GFR or the higher the albuminuria, the poorer the prognosis. This shows that the higher the BUN or serum creatinine, the lower the GFR function. This shows that chronic kidney disease is the number 8th cause of death and disability combined in the Philippines as of 2017. This shows that hypertension and diabetes type 2 are the most common cause of chronic kidney disease as shown in the dark blue, and the light orange bar graph. These are the other risk factors for chronic kidney disease. This is the continuum of development, progression, and complications of CKD and strategies to improve outcomes. In patients with normal kidney function, screening for CKD risk factors is advised. And in patients with increased risk, CKD risk factor reduction should be implemented. So that is why it is important to know the risk factors of chronic kidney disease. And in patients with kidney damage, we should treat the comorbid conditions. And in patients with decreased GFR, we have to treat the complications. So with these strategies, lifestyle intervention is important. This shows the prevalence of CKD complications by GFR category. The lower the GFR, the higher the prevalence of CKD complications such as anemia, hypertension, vitamin D deficiency, acidosis, hyperphosphatemia, hypoalbuminemia, and hyperparathyroidism. So that is why in patients with CKD, we have to slow or retard the progression of CKD so as to decrease the risk of developing these complications. As lifestyle medicine practitioner, we should apply the 6 pillars of lifestyle medicine. But in this topic, we will focus on nutrition. The main nutrition-related goals for people with CKD are the following: slow the progression of kidney failure, minimize uremic toxicity and metabolic disorders, diminish proteinuria, maintain good nutritional status, lower the risk of complications such as cardiovascular disease, bone disease, and disturbed blood pressure control. In patients with CKD, cardiovascular disease is the most common cause of mortality. This shows the effects of whole food plant-based diet. It increased the fiber intake. The increase in fiber leads to increased saccharolytic catabolism, thus increasing the short-chain fatty acid production and bile excretion. These short-chain fatty acids are beneficial to patients with CKD. Increased fiber also increases glycemic control and increase insulin sensitivity. Glycemic control and insulin sensitivity is closely related to diabetes mellitus type 2, which is the most common cause of chronic kidney disease. Increased fiber also decreases serum cholesterol, decreases serum urea, and decreases serum creatinine. Whole food plant-based diet also leads to decrease in lipids. Decreased lipids results to decreased dietary serum and cholesterol, decreased saturated fatty acid, decreased lipid nephrotoxicity, decreased microalbuminuria and proteinuria. In whole food plant-based diet, there is relatively low protein as compared to animal-based diet. The low protein leads to decreased proteolytic catabolism and results to decreased uremic toxicity and inflammation. In low protein also, there is an increase in phytonutrients and antioxidants. Uremia and inflammation are one of the main contributors of CKD progression. So that is why in whole food plant-based diet, we can delay the progression of chronic kidney disease. In low protein, there is also decreased renal hyperfiltration. There is also decreased FGF23 and decrease in phosphorus. However, there is a risk of protein malnutrition. But in most studies, protein malnutrition using whole food plant-based diet can be prevented in patients with carefully planned diet, especially those who are undergoing maintenance dialysis. So the increase in fiber, decreased lipids, and decreased protein could lead to decreased blood pressure, decreased inflammation and CRP, decreased cardiovascular disease, and decreased mortality. This shows the effects of vegetarian diet. The decrease in fat, decrease in carbohydrates, high in fiber, and decrease in protein could lead to decreased adipose tissue dysfunction, decreased beta cell dysfunction, decreased insulin resistance, and decreased endothelial dysfunction. Adipose tissue dysfunction, beta cell dysfunction, and insulin resistance are closely related to diabetes mellitus type 2. Endothelial dysfunction is also closely related to hypertension. So thus, in patients consuming vegetarian diet, hypertension, diabetes, and chronic kidney disease could be treated with this strategy. In vegetarian diet, there is also decrease in phosphorus, decrease in acid load, and decrease in salt. So this could lead to decrease in GFR degradation and can decrease the cardiovascular complications. Hyperfiltration is important in the development of chronic kidney disease. Hyperfiltration happens when there is a high animal protein intake as shown in this figure. High animal protein intake results to dilated afferent arteriole, which could increase blood flow and GFR. It could also result to impaired autoregulation. So because of hyperfiltration, there is increase in capillary diameter, damage to podocytes, increased capillary wall tension. This could result to proteinuria. These are the effects of animal-based diet. Upon consumption of red meat, cheese, and egg yolk, it is acted upon by our gut bacteria, producing L-carnitine, choline, and phosphatidylcholine. A byproduct of this process is trimethylamine N-oxide or the TMAO and p-cresyl sulfate. These TMAO and PCS are mainly excreted to the kidney. However, in patients with CKD, excretion of these substances is impaired, thus resulting to increased TMAO and PCS in the blood. TMAO and PCS contribute to cardiovascular disease. Thus, animal-based diet increases the risk of cardiovascular disease, especially in patients with chronic kidney disease. In contrast to the previous slide, this is the effects of plant-dominant low-protein diet. So there is a vasoconstriction of afferent arteriole, thus preserving the glomerulus. So there is also a decrease in intraglomerular pressure. So we prevent the hyperfiltration which happens after high animal protein intake. Hyperphosphatemia and hypocalcemia is also a complication of chronic kidney disease. Phosphate is mainly excreted through the kidney, but in patients with CKD, there is phosphate retention, so thus increasing the phosphate in the blood. Hyperphosphatemia causes secondary hyperparathyroidism. Due to hyperparathyroidism, there is bone resorption which could result to increase in calcium and phosphate, further increasing the phosphate in the blood. And in patients with CKD, sometimes we give calcium supplement. So this calcium supplement could increase absorption of calcium, thus resulting to increase in calcium in the blood. The increase in phosphate and calcium in the blood could lead to calcification of our blood vessel, resulting to cardiovascular diseases. So with concerns of hyperphosphatemia, it is important to know which phosphate source are less bioavailable. So as listed in this table, plant sources is only 20 to 40% bioavailable. In processed foods, such as in organic phosphates, phosphoric acid, the bioavailability of phosphorus is around 90 to 100%. And in meat products, up to 80%. And in dairy products, 30 to 60%. So that is why in whole food plant-based diet, we could probably avoid hyperphosphatemia because phosphorus is less bioavailable. Metabolic acidosis is also a complication of chronic kidney disease. So that is why it is important to consider the source of acid load in the diet. So based on this figure, in the left side, acid producing are mostly from animal-based products, and the base producing is mostly from plant-based products. So these are the effects of high dietary acid load. If there is metabolic acidosis, our body would tend to stabilize the pH, this one. So when there is high dietary acid load, there is muscle catabolism, which could increase ammonia genesis, increase intramedullary ammonium concentration, and increase net acid excretion. And also if there is high dietary acid load, there is decrease in renal cortical pH, increase angiotensin 2, endothelin 1, and aldosterone, which could result to increase net acid excretion. However, in CKD and in chronic high dietary acid load, so this could result to hypoalbuminemia and sarcopenia, complement activation, fibrosis, which could result to progressive kidney disease. So and also, to stabilize the pH and bicarbonate, there is increase in bone resorption. But if it becomes chronic, this increase in bone resorption could lead to decreased bone density and lead to fracture. So that is why in patients with CKD, we have to choose foods that are low in dietary acids, such as those from whole food plant-based. Muscle wasting or sarcopenia is also a concern in patients with chronic kidney disease. Sarcopenia or muscle wasting is not just the result of protein limitation in the diet. CKD also has a direct effect in muscle wasting, such as it could result to increased protein degradation and decreased protein synthesis. It could also decrease muscle growth and muscle hypertrophy. So these are brought about by oxidative stress and inflammation and insulin resistance. We all know that insulin resistance, oxidative stress, and inflammation are caused by animal-based diet. And plant-based diet is protective of this insulin resistance and inflammation. Hyperkalemia is also a concern in patients with chronic kidney disease. Potassium has many benefits. So it has BP lowering effect, beneficial effect in reducing stroke, bone homeostasis, kidney stone risk, and decreased progression of CKD. So this is the overview of potassium homeostasis. After intake of potassium in the diet, it goes to extracellular space. So 90% of it are excreted through the kidney and 10% is secreted in the colon. However, in patients with CKD, colonic secretion is increased because of the decrease in kidney excretion. It is also important to note that hyperkalemia can be prevented if we shift the potassium into the intracellular space. So this could be affected by the insulin and beta stimulation. So the characteristics of a diet enriched in fruits and vegetables that minimize hyperkalemia. So because in whole food plant-based diet, there is a carbohydrate load. So it causes stimulation of insulin release, thus resulting to the shift of potassium into the cells. There is also an increased alkali content in plant-based diet. So that is why it shifts the potassium into the cells. The high fiber content also increases stool bulk so that there is a less potassium reabsorption in the kidney, in the colon. There is also a decreased constipation, so resulting also to decreased reabsorption of potassium in the colon. So because in plant-based diet, there is no exogenous potassium such as from flavoring, unlike in the meats and processed foods. So this is the relationship of constipation and adverse outcomes in chronic kidney disease. Constipation could lead to gut dysbiosis, and gut dysbiosis could further increase constipation. Gut dysbiosis could lead to gut epithelial barrier dysfunction. Constipation is usually promoted with the use of animal-based diet. So animal-based diet increase the production of endotoxin, PCS, bacterial DNA, TMAO, and endoxyl sulfate. So in animal-based diet, so it could promote constipation, it could increase the production of these gut-derived toxins. So this could lead to inflammation and cardiovascular disease, chronic kidney disease, and mortality. However, in plant-based diet, we could avoid the constipation and lessen the production of these gut-derived toxins. So the take-home message are the following. Plant-based diet reduces the risk of chronic kidney disease because of its proven benefits in the prevention and management of hypertension, diabetes, and other CKD risk factors. It would seem to be a very valuable prophylaxis. Plant-based diet is a better nutritional option to prevent hyperphosphatemia, uremia, acidosis, proteinuria, and intestinal dysbiosis in CKD patients. It can also help prevent chronic kidney disease from advancing to end-stage renal disease. CKD often occurs in the context of multiple comorbidities and has been termed as disease multiplier. So plant-based diet helps in prevent and treat type 2 diabetes and other cardiovascular disease. It can also help prevent and treat coronary artery disease, which is the leading cause of mortality in CKD. Plant-based diet has no contraindication or adverse reaction, given that there will be a carefully planned diet for these patients, especially those who are undergoing maintenance dialysis. So it should be a team approach of lifestyle medicine physician, nephrologist, and dietitian, and other allied health professionals. It reduces healthcare costs for both the patient and society. Carefully planned low-protein plant-based diet do not result in malnutrition or hyperkalemia. It may also be possible to raise the amount of protein in diet if the protein is plant-derived. Given all the benefits, the plant-based diet deserves a place among the physician's treatment options for CKD. So thank you for listening.
Lifestyle medicine for COVID-19 and NCD care, a wake-up call. This event is proudly supported by the Lifestyle Medicine Global Alliance, the American College of Lifestyle Medicine, the International Board of Lifestyle Medicine, the Department of Health, and the Philippine Medical Association. The Philippine College of Lifestyle Medicine is also supported by several institutions pioneering lifestyle medicine practice in the country. The Remnant Institute Incorporated, a center for lifestyle medicine and education. The Adventist Medical Center. The Four Leaf Lifestyle Medical Group Corporation. The Plated Prescriptions. And the Culinary MD. This event is also made possible through the help of our sponsors. The Pascual Pharma Corporation. The Omron. Simply Nature. And the Foligo.
Our vision is to be distinguished as a fast-growing Filipino pharmaceutical company advancing a legacy that provides reliable, high-quality health and wellness that are responsive and relevant to the changing needs of patients and customers. Blumea balsamifera Sambong Leaf Relief Forte. The longer, the better. Relief Forte. Relief for urinary stones. Acetylcysteine, Acetimax, dissolves mucus to the max. The number one 50 milligram sildenafil brand in the Philippines and the most prescribed sildenafil citrate in the market. Zilden, now on its 10th year. Manage your BP. Protect your kidney. Like a pro. Irbipro, the certified safe irbesartan. The only prescription-grade L-carnitine available today. Enhance your heart score with Carnicore. ACE inhibitor enalapril is recommended by the ESC for heart failure with reduced ejection fraction. Enalapril maleate high pace. Keep their hearts at pace. Eliminate potassium loss worries during diuresis. The only furosemide with potassium. Diamide K, ang furosemide na may K. Pregabalin Pregasafe with AAA effect, analgesic, anti-epileptic, and anxiolytic. Pregasafe, no pain, all gain. Fluocinolone acetonide, Aplocin, the reliable topical corticosteroid for acute and chronic dermatosis. Aplocin. Brought to you by Pascual Pharma Corp. Building a legacy of care.